In the next several minutes, I hope to answer both of these questions. What is prescriptive teaching, and why should I use it? So, let us begin. Prescriptive theories are general frameworks within which we draw conclusions. The situation in which prescription is most familiar to us involves going to the doctor when we don't feel well, with the expectation that the doctor knows how to make us feel better. When we arrive at his office, we are taken to a private room where a nurse, the doctor, or both question us about our symptoms. Then, based upon his knowledge about the potential causes of our ailments and about effective cures for them, he determines a plan for making us feel better. Typically, his plan involves a written note prescribing some sort of medication that he thinks will have a positive effect on our symptoms, and a follow-up appointment with us to check on our progress. In prescriptive teaching, the teacher is the doctor and the students are the patient. Thus, students arrive at our classrooms expecting us to help them meet academic standards. As teachers, we analyze how far along each student has progressed on their journey toward mastery, and then, using what we know about teaching and learning and the various factors that influence them, we prescribe a plan of action to help each student move closer to achievement of expected academic standards. And, like the doctor, we check back with each student on a regular basis to determine the effectiveness of our plan. Prescriptive teaching involves the consideration of 4 key factors, all of which impact the outcome of teaching and learning. These 4 factors are present in every teaching and learning situation. They include the student, the teacher, the content, and the context. Each of these influences the other in significant ways. As the teacher, your initial focus is always on the student. Prescriptive teaching begins with a diagnosis to determine the learning characteristics of the child in order to match instruction to the child's particular learning needs. In the teaching of reading, the teacher is particularly concerned with personal experiences of the child with print, phonological abilities, oral and reading vocabulary development, accuracy, fluency, and comprehension. When severe deficits occur in any of these attributes, teachers may need to involve additional professionals in the diagnosis of causal factors. Qualities such as visual and auditory acuity, discrimination, and tracking are typically assessed by other professionals, such as the school psychologist. Thus, a team approach is required in effective prescriptive teaching. The most difficult part of prescriptive teaching is translating the diagnosis into effective suggestions for practice. The one thing that is certain about this difficulty, however, is that with prescriptive teaching, there will never be a recommendation of one size fits all. Just as the diagnosis for each student will be different, so will the prescriptive plan. So why use prescriptive teaching? The answer to that is simple: because it works for every learner. That's it. After all, isn't teaching about making sure every child has an equal opportunity to learn? Yes, it is about that. No one who uses prescriptive teaching to accommodate the diverse needs of a classroom of unique, energetic, creative, and inquisitive children has ever claimed that prescriptive teaching was easy. It isn't. It isn't thoughtless. It isn't quick. And it isn't easy. But it is well worth the effort.